Hello everyone, thank you for joining us today on the program Healthy Living. My name is Adisuwa Osa Owagie. Often a time you hear a certain young person died so sudden, or somebody you saw yesterday will you wake up to the news the next morning to hear that the person has passed on, and you keep wondering, he wasn't sick, she wasn't sick, what would have happened? What could be the reason for this sudden death? This is exactly what we want to look at today on the program Healthy Living, and of course how to avoid it, and most importantly the need for you to see a doctor the moment you feel that something is wrong with your body. The moment you don't feel the way you used to feel anymore health-wise, you should see a doctor. Nothing should be taken for granted. As ordinary as people see malaria, it kills not only children but adults too. So there is an urgent need for Nigerians to always see a doctor, particularly this period of COVID-19. To do justice to this topic, I have a doctor in the house. He is Dr. Barry Ojo, a consultant family physician. It's nice to have you on the program.
Thank you, Mom.
And congratulations on the new title.
Thank you very
So we
much.
go watch Abby.
Thank you very much.
All right, people. This is Dr. Barry Ojo, and we want to talk about sudden death. Doctor, when we talk about sudden death, exactly what are we looking at medically?
Well, medically, sudden death can be defined as an apparently well individual who, of course, in any form of eventuality, suddenly we notice that the person is gone. So the person was not obviously ill, maybe the person was not on admission, the person was not having any obvious symptoms, so that you just somebody well GSL, or see somebody in the morning, in the afternoon to tell you the person was in the office, slept and never woke up, for instance, or somebody went for a sport activity or a show exercise, the person slumped. So that is an umbrella word for sudden death. But what we're going to be looking at today, because if a man is doing sports or running on the street and is knocked down by a vehicle, that's also sudden death. We're looking at the medical aspect of sudden death. But before we talk about the adult
But at
sudden
least
death,
that one, you will know that the person was knocked down by a
yes,
vehicle.
because there's an external insult.
Yes.
But before we look at the adult sudden death, let's look at the children's sudden death. There's what we call the sudden death, sudden infant death syndrome, where this is common upon the children that are less than 1 year. And the mother keeps a baby in the cot or maybe in the bed, only to wake up in the morning that the child is gone. So this is a very common experience, especially among African Americans and among blacks. So what are the risk factors for that? One, the most common one is the position at which you are lying the child. If you lie the child on a prone position, that child was face down, that's a prone position. You run a higher risk of having sudden death down to put the child up on the supine position.
But often the time you hear people say that is the best way to keep a child, is to make the child sleep. It will make the child sleep for long and properly.
From all the studies, the children that are on prone position die faster than the one that is lying on the back. That's just one of them. There are several risk factors.
So it is wrong for a parent or for a mother
to lie the child on the back, not on the stomach.
Okay.
So there are several risk factors. A child that was born premature run the risk of that sudden death. A child that had low birth weight. Of course, children from low socioeconomic strata also run those kind of risks. Of course, you are in an environment that is overheat or overcold. So the child is going to run the risk of a sudden infant death syndrome.
So how do we avoid all
but
of
there are
that?
several other factors that can be responsible. But the best way to avoid these things is to put the child in a safest environment. Of course, if parents are smokers, you avoid any form of smoking around the child, because that child can suffocate, because that child might be snoring, might be having difficulty in breathing, and maybe has some mind illness. That's another thing. Recent illness is a very risk factor for sudden infant death syndrome. Of course, a child that has had a sibling that had died before could also run the risk of infant death syndrome. So prevention is basically just to keep the child in a safe environment, put the child in a supine position, lie the child upward. Of course, the child should sleep in a separate cot with the caregivers or the permanent caregiver like the mother, putting an eye on the child. Notice when the child is running temperature, notice when the child is having difficulty in breathing, notice when there's any difficulty, maybe the child is suddenly turn blue. So the best thing is that when you notice that the child is feeling unwell, what we are saying here is that you quickly take the child to the nearest hospital, so that we'll evaluate the child before the child will go and sleep and all. But even though in this environment, they can attribute to African science, say, now much. Then another thing on this one. One of the commonest risks you can see if sudden infant death syndrome is simply male child. So I have somebody in my village who had 2 male children. They had suddenly father syndrome, and it was attributed to his second. People were after his, and those are on risk factor, but those are hormonal. But that's not what we're discussing today.
Yes.
But now the prevention is just put an eye on a child. That's why they tell you that in nursing period, a mother cannot sleep because you must be awake at every time. Because child can die of hypoglycemia. There could be other immediate problem in the child. Child may not have fed for some time, and the child sugar become low. Child can start convulsing, and child can pack up. Child may be having some underlying illness that is not discovered by the mother. So that is why we are saying that once you notice a newly born child with any issues, you can take child to the hospital. Then for bigger children, of course, child can have childhood asthma, child can have like type 1 diabetes that is very common in children. So most times they come in hyperglycemia. So a child that is 7 years old can come in coma. The first thing we must run is the sugar level, because you might just be having a very high sugar. And if you're not waiting for the child can pack. So those are sudden death syndrome.
Okay, please explain further on this issue of diabetes in children, because a lot of parents, that will be the last thing that will be on their mind.
Yes, but once you notice that the child is losing weight,
yes,
and you notice that the child has increased in rate at which he maturates, so there's increase at which there's increase in rate of the child is urinating. Child is losing weight, then you come and tell the mommy, when I urinate, I notice that aunt dadders. So you should have an eye that suspicion. Child is having good appetite, but child is losing weight. There's history of diabetes. Maybe the mother or the father or the grandparents are diabetic. So that gives you some risk factors around that child. So once you notice those things, urinary symptoms, child is losing weight with good appetite, child is complaining, even vision difficulty. So you have to look at all these people together so that the urinalysis, which is the routine test of the sugar level, will be tested on that child. The same thing with sickle cell. I saw a child that was 13 years old. Parents never knew of sickle cell. That was about 12 years ago. So
apparently
as at 13 years in JS2, that was when they were discovering that the child was there, or sickle cell. So such child can have what we call stroke, but the child can have failure in brain activity, because those are some of the complications of sickle cell. So if the child just suddenly has stroke and dies, and you don't know the genotype, for instance, that could be responsible. Talking about bigger children. But let's come to adults. The adults, I tell you this one.
No, before we go to the adult, I want to quickly ask this question.
Yeah.
You know, I've heard stories of children being taken to hospital, and then after injection, they die.
Yes, because at the end of the day, this one, you and I know
because
that.
I'm wondering
you and I
why.
know that in this environment, human error is very common. Let me give you an example. You write chloroquine injection for his eye, and they have an old drug for anti-malaria.
Yes.
And or else it's just a quinine infusion. You are to give the quinine infusion into the drip, and the nurse or whoever now mistakenly give it directly to the baby. The child has heart attack. So if wrong medication is given, child will pack up. Then of course, wrong attention. If a child is having anemia, and the child present, 8 years old child is having anemia, maybe PCV or 24 or 23, and you are not looking at the anemia, you are looking at the fever, you are looking at the typhoid or whatever you think it is. Child dies of anemic heart failure. So wrong attention is a problem. The inability to get the diagnosis right. That's why in pediatrics, they will tell you that you must have a high index of suspicion. So there are so many differentials that can be responsible for a child's presenting. Child might be abused. So there are so many things that are responsible. I have a friend of mine whose niece took poison not too long ago. If you have not discovered that 14 years old girl took sniper and whatever before Christmas, you would have been able to get to the roots to start giving antidotes and other treatments. So there must be a high index of suspicion in children. Let's say bigger children between the age of 7 and 18. And these days of D5, digital substance abuse, you want to do Yahoo and all that. So you must put an eye on any adolescent, let alone bigger child. So a parent must have high index of suspicion. So if a child is complaining, if a child is having chest pain, don't underrate it. Child might be having failure.
You know, parents are quick to giving PCM. Once the child says, oh, I have this slight headache, I have pain in the chest, the person needs to go to hospital, not giving the child
Exactly,
PCM.
they give abdominal pain. It's not saying the child has worm. The child might just be having malaria that is coming up. The child might have other problems with the abdomen. So if I've seen the child at the KO, he has been having recurrent abdominal pain, 9 years old yet. All to do the genital child was SS. And the man screamed and said, oh, these scientists don't kill me. He told me I was 80. So that's why it's always advisable at the verge of getting married. It's always good to go to a conventional lab or a government hospital and repeat your genotype. And at the end of the day, that child was SS. Was having recurrent vaso-occlusive crisis. The spleen was enlarged, or they commonly call Ude. So the child was becoming anemic, but he's having recurrent abdominal pain. But that child had what we call hemoglobinopathy, sickle cell disease. So that is the way we look at it. In children, it is stated clearly that don't use self-medication. At worst, take the child to the nearest nurse. Funded, the nurse can forward the child to the good private hospital or the government hospital. That is key. So when it comes to infant death syndrome, Most of the death that you see in children may not necessarily be spiritual like the way you are attributing. It can just be complacency or negligence of the parents. A child is complaining of eye problem. Child might be having glaucoma. I think the child is having glaucoma. But my eye, the increase in intraocular pressure. And when there's already pressure in the brain, so that activities will happen. So you don't take things for a ride. When even leg pain, if you start having knee joint pain, so what you go do? You go play ball. Whereas the child having septic arthritis, which can lead to septicemia. So you don't underrate any child's complaint. So I use this medium to advise parents. Any child that is below 18 is a child. Put an eye on the child. My friend called me Sunday and said he saw the son with a lot of cigarettes and nothing in the world. And the boy was a Christian boy. So that's a look at expose the child to sudden death. So you must have eye test of suspicion. If a child tells you 10 things, try and believe one or two. Deep to their room, go to their wardrobe, because you might discover something that can for that lady child to untimely death. So children, sudden death syndrome is another story for another day. So if you look at the adults cases, it is obvious. What is the problem of death, adult death syndrome? There are some there are some common causes that you can say as an umbrella. But the commonest is the coronary artery diseases, which is an umbrella word. There's what we call common discordis. Common discordis is simply defined as somebody is having a heart problem and there is now supraventricular failure, whatever it is. There's tachycardia, increase in heart rate, after there's fibrillation. And when you don't quickly intervene in such patient dies. There's what we call Bugarda syndrome. So there's first heart block, the second heart block. There are so many causes. Of course, asthma. We know for our brother recently, not too long ago, the Nollywood actor that died in a worry. He was asthmatic. So if the man may have what we call pulmonary. Pulmonary is that patient is having a cardiac problem, a heart problem, but he now had a respiratory failure, who could have been emanated from the asthma, because he was asthmatic. And the whole world came to the barrier. That is nobody. So that's sudden death, somebody that was socially thin. It's the most painful kind of. I'm a family physician. I know how painful to talk about grief reaction.
But can we really call that sudden?
Because
there might have been signs, there might be
the definition that you might have an underlying layer. We'll come to investigations. There's what we call screening. There's what we call screening test and diagnostic testing. Because if you're talking about screening test, we're looking at apparently well individuals. Diagnostic testing, that patient has some complaint, has some stomatology, want to do some tests. So the man that is not well, apparently, the commonest thing in our histories, the physician will tell you that the man was apparently well until so many days ago. So if somebody that is not well will not go to shoot a film. And I look at the story for Kwaraji in 1989. So one of the commonest causes of death, something designed in sports people and young adults between the age of 20 and 40 and this one, is hypertrophic cardiomyopathy. That the heart has a lot of problems. The heart is not dilated. So the heart is dilated, so many the ventricular refilling is not available. So the heart will not have enough blood to separate to the main part of the body, and there will be heart failure. And when there's that failure, there will be systemic dysfunction, and the patient dies because oxygen will not be cut off to the brain. Because once you don't have enough blood to the brain, there will not be oxygen. So the umbrella causes of sudden death syndrome in adults is one, you are looking at arrhythmias, the one you are trying to mention. Talking about aortic stenosis, talking about mitral valve prolapse.
Doctor, if you break all of this down for us in simple language,
yes, what we mean is that there might be problem with the valve in the heart.
Okay.
There might be blockage. So many things could be responsible both the architecture and the electrical activities of the heart. You know what, the heart has to do echo to be able to diagnose some of these things. Because you look at the architecture of the heart, you look at the electrical activity, that's also the ECG. So when these activities are not working well, like the woman that died in the Maragorati, the woman was dancing as well. She was dancing very well. So she packed. Look at the hearts were not working. She might have stenosis. She was admitted in one of the hospitals about 5 months before that time. So there was history of heart pathology. So arrhythmias are one of the common, which corona heart disease is one of them. Wow. Of course, the one you and I know. Talking about the number 2, acute myocardial infarction. That's your heart attack. You know, stroke is brain attack. We got it shortly. So the heart attack is where you don't have enough oxygen. There's already cut of blood supply to the muscles of the heart.
What could cause such of oxygen?
Because they have problems. For instance, if a person has a long-standing hepatitis heart disease, not well controlled, you don't have adequate ventricular filling, you are not on your medication, you are living a bad lifestyle, you are taking excess alcohol, you are smoking as if it doesn't matter, you live so many risks. Of course, you are obese, you are not watching your weight, you don't know your BMI, you are not a regular hospital attendant. All this lack of activity to be able to gather a good graceful aging will exacerbate or worsen the illness. And once it worsens, the heart is one of the biggest targets. So when a patient does not, that's when it does that myocardial infarction. So many of those muscle tissues are becoming burnt away. There's ischemia. So that is for that. Then you now come to one of the commonest problems. They're talking about the pulmonary edema. when you see somebody that say he can't fall, he was not bringing blood from the mouth or bringing food,
or
frottis put on, if you like, bloody frottis put on. And what are the risk factors to pulmonary embolism? The problem is more of lungs than of heart. That's what they call the cardiac asthma. So the system is failing. And what are the risk factors? Somebody may have done a surgery. Somebody might be above 65 years. Somebody might be a chain smoker. Somebody might be living a sedentary life. And the one called deep vein thrombosis, the DVT, blood is no longer flowing well from the lower parts of the legs or the limbs down to the heart. And an emboli, something like a clot, will be thrown up. And before you know it, the patient will not have problem with the heart activities. Of course, you compromise the pulmonary vessels. Of course, the lungs are going to fail. So the patient will pass. Then, of course, the aortic arteries, which is very key, that helps to take blood most of the time away from the heart. Once you have aortic problems, like you talk about aortic stenosis, you have aortic aneurysm, you have aortic dissection, and these are things that marry the aorta, where a lot of blood are being pushed away from the heart. So once there's a distortion, with an aneurysm, there are so many causes of that. Then the patient can pass.
What is the commonest cause of that?
No, because of course you are looking at a patient that has had long-standing hypertension. You are looking at a patient that has had some even long-standing heart problems that has not been managed properly. That's why we talk about cardioconverters, we talk about AEDs, we talk about cardiac catheterization, which I don't know when we in Africans are going to get to that level. But that's the cardiology story. Yeah. So, but again, a lot of these causes are unknown. Don't forget that the commonest cause of sudden death is unknown. Because in this environment, when somebody dropped, like one of my neighbors, the police went to the hospital last week and he died in the office. What was sick? And they will tell you, they are a policeman and Aisha man, I said that they died. So people will not look at, was he having some health challenges? Was he having some symptomatic situation? Was this man having any underlying pathology that he never discovered? That's what I'm telling you, that we talk about screen testing and diagnostic testing. Because screening is, you want to do normal general screening. You are just screening a population. You are not necessarily screening to discover whether there is a problem. So that if there's a problem, it will be early detection, so you will do intervention. But diagnostic testing is what the Europe and America has surpasses us. Because over there's periodic medical examination. So we don't do that here. Let me tell you something. Let me tell you the bad news. There are so many things up to diabetes that can lead to unsteady death. Because if somebody is diabetic, do you know that the electrical urea and creatinine test that you do to diagnose somebody is diabetic, until the kidney is 75% damaged, the UEC will not be deranged. So the potassium will still be normal. The sodium might still be normal. The urea can still be normal. The creatinine can just be a little bit elevated. Until the patient now has over 75% damage. And you know that the commonest cause of those kidney problems is diabetes. How many of us are doing well with our diabetes control? So that is another story for another. So a patient can go into acute respiratory failure. It's because it's sudden death. He might have an underlying pathology. But this patient was in office yesterday. Patient took the family to for an outing. Patient traveled to the village. I know of a medical doctor who went to the village to do the uncle's burial in Rome. But the man died. They went to the church. Before they could call, the man was one of the biggest doctors in town. I wept. So you can understand the level. And this is a man that I know that everything about him was apparently well. So you may not be able to explain some of these things. That's what we're saying here in this healthy living program. Do your regular checkup. You don't wait. For example, you're having difficulty in your eyes, maybe vision and all. Even to the ophthalmologist. Because for that, they can just discover the patient is having eye sugar. Because if you're not having what we call glucose intolerance, which means your sugar is already going up, then from there they can intervene. It doesn't necessarily mean that the problem with the eye is directly with the eye. We're talking about erectile dysfunction that can lead to depression. If you know that the problem is already come, don't get shy about it. Go to the hospital. Because from erectile dysfunction, to lead to family dysfunction. And from family dysfunction, someone can go into depression. So I know of a doctor who of course, what they were saying that he may have committed suicide. You might discover he might be having some of these problems. So you don't let one problem lead to the other. That's why Europe and America is key. Our nation is getting it right. When we talk about coronavirus, I will tell you where India missed it. But what we are saying is that we should turn to the hospital. Because sudden death syndrome should not be our portion. So if you go to the church on Sunday and do prayers, and you are not following the medicals, it's an aberration. Because you must do first like the Anglican faith which I profess. So if you don't go to the church first, in the Anglican faith, forget it. You will see the doctors first. Why I say the doctors who are doing our prayers? It's commonsensical. Because what if you have a major heart problem? And there are symptoms of long-standing hypertension. There's what we call Gallup reading. If they now look at your heart, which can only say those scores, there's S3. Because you have X1, X2, S3, and the 4 heart sounds. Once you see S3 in a young adult, most of you may have a heart problem. Of course, once there's S4, it's pathological. So at the end of the day, you don't now wait. So you now find out what is it. You're going to go and do an echo. You do some other heart chemistry. Then look at the one that is very common with us as the 5th cause of sudden death. Cerebrovascular accident. What are they? An umbrella words. It's not stroke. Stroke is a part of this CVA. So you have TIA, transient semi-attack. You have RIND, reverse ischemic deficit. They have duration and definition. But the stroke is what we know. If a man is not regular with hospital attention, he's going to come down with stroke. What has led to stroke? Is it witchcraft? It's carelessness. Because if you go to regular check-up hospital and you are told you are hypertensive, God so the people, the Indian, they supply so many drugs that are cheap, that are affordable. Then you go with your lifestyle. Stop smoking if you smoke, avoid and reduce alcohol. Of course, watch your weight. Of course, do a lot of course, do a sleep hygiene and all that. And do some compatible exercise. And we're talking about compatible exercise. Compatible exercise means that it has to be compatible with your health status, of course, your individuality, and of course, the environment. Recently, a very big pharmacist was knocked down in Airport Road because he was going on the road. So there was a hit around. So, but if you have done those exercises within your environment, I know they were attributed to so many spirituality, but what we're saying is that exercise must be done in a safe environment. So when you do all this lifestyle modification, and of course with your good diet, I think most times you'll get it right. That's what they're doing in the diaspora. But why they're having more problem with cancer and all of that incipient illnesses is because, of course, because their diet, their lifestyle. So that's why cancer can be a risk factor to that punani policy we're talking about. So if a patient has cancer, the blood is not flowing well.
Let me take your mind back a little bit. Sudden death in young ones. You find young men, young ladies between 18, 30 dying just like that. And then, I don't know, we have quite a number of vices in our society, particularly amongst the youth. We talk about drug use, even abuse of medications. You get medication from hospital, substance abuse, and all of that. Can you just help us talk to this youth a little bit on what to do to avoid all of this?
Let me tell you this. Because the commonest sudden death in young adults, like about between 18 and 30, it has to do with the heart. That is in terms of sudden death. The patient, they may have had what we call hypertrophic cardiomyopathy, either on strenuous exercises. Then because the pathology might be there, but it will now be worsened by maybe strenuous exercises, up to even during love making, and of course your substance abuse that they are taking, that will now exacerbate the problem. There are no 2 brothers that died between 2013 and 2015 in a primary school somewhere in New Benin. The same football they went to play, one is older than one, and they collapsed and died. And again, as I forget, some of these heart pathologies run in family. So for instance, the hypertrophic cardiomyopathy.
And there will be no signs, there will be no symptoms. No signs, no symptoms.
Of course, most times there might be difficulty in breathing. There might be chest pain. For instance, the heart failure, where the heart attack, talking about the calvarium infarction. Patient will tell you my chest is crushing. Patient will have inexertion. Patient will have what we call diaphoresis. There will be discomfort. Patient will be feeling unwell. Patient gets tired easily. But you don't go to the hospital. So rather they will patronize these people that use substances, these supplements and all that. Patronize spiritualists, patronize and patronize. Whether the hospital is your best friend. The hospital is more your best friend than the police. So nobody is going to take anything from you. A genuine doctor, like those of us that are family physicians, it's not everything we're going to attend to. We'll triage. When I know that the patient has a cardiac pathology, after I've done my preliminary investigations, I refer to a cardiologist. Even follow the patient on phone. Because patient may be having other underlying illness. But they don't do all that. Of course, the nature of riscality. You talk about the Yahoo syndrome, you talk about SS drug, talk about a lot of things. Young people are involved in a lot of strange activities. That even their parents, when they discover, they will be aghast. So that's another story for another day.
Now let's look at cocktail of sports drink. Because you see a lot of these young men with tall cocktail of sports drink. They have all sorts of sports drink. They could have like 6, 7, 8, you name it, a mixture.
Yes,
of all of this.
Yeah,
I was watching a video on social media, and this young man came up with all sorts of sports drinks. They had them. They were turning them into a bowl, and then white substance was added, and then they drank. Some of them couldn't take it. Some collapsed, some just didn't see anything, some passed on like that. It was quite a pathetic.
That's why we are using this medium and media to tell the public that, look, don't allow young people, if you get into these things, because most of the things, it's calamitous. Because by the time you now bring all these substances, we don't know the consequence. Some of them will contain steroids, some of them are hormonal combination, some of them they are toxic to the heart, some of them they are toxic to the lungs, some of them are toxic to the abdominal, so the intestine and all that. So you can affect the system. So I tell you are taking strange things to your system that you don't know the consequence. I guess you the outcome is always very great. That's why we're appealing to the public. Let not your people involved in things like you see a lot of adults. You see some men taking drugs.
Okay, what would make somebody bleed from the ear, the nose, the mouth, and before you know what is happening, the person is gone? You could be talking to somebody and all of a sudden the person is bleeding from the nose, from the ear.
That's what I'm telling you now. If there is already a cardiovascular problem, or cerebrovascular, I'm talking about the problem of the brain, and there are problems with the cardiovascular system, even the respiratory system, like the pulmonary edema. Some of the patients, they start having bleeding from what we call hemoptysis, bleeding from the nose, they'll bring fortis sputum. So obviously, if there's no trauma, if there's no issue of trauma, usually fall from a height, usually was not known down. Once things like that happen, you know, the respiratory, the cardiovascular, and even the central nervous system may affect. That's why we're saying that once you notice, like for instance, recurrent dizziness, you are noticing some abdominal sensation, you come to the hospital.
Recurrent dizziness, the next thing is to get a cup of milk and drink. That's what people do.
But you don't, because you will not be, especially when it's recurrent, you might not understand what could be responsible. So that's what we're saying, we're appealing to the public. Once you notice any form of symptomatology, don't be your individual doctor. Because even medical doctors, the senior ones, they don't give self-medication. So even as much as the chief medical director and every other person in the hospital, they go to another doctor to get their attention. So you don't begin to do self-medication, and you don't assume, because your assumption might be erroneous. So once it's erroneous, one thing will lead to the other. Because one thing about primary prevention is, I have a symptom, or maybe I don't have a symptom, I go for regular checkup.
Yes.
So you are preventing. You don't have a problem yet. Then when you now have a problem, we want to see how we can intervene so that there will not be complications. That's secondary prevention. The tertiary prevention is, oh, and I have this, or this thing is there, then how will I manage the complications? So for instance, if I'm diabetic and I now have glaucoma or I have cataract, how do I now manage it so that I will not go blind? That's tertiary complication, prevention. So we are telling the public, you can't do it alone. Most times you must come to the hospital so that they give you the attention that you needed. And whether you like it or not, routine investigations will be done, specific investigations will be done, whether imaging or laboratory, and of course, the axillary investigation will be done. And while you are doing, have you not heard, maybe you've not heard of stroke in the young. Any stroke that takes place before 40 years of age is stroke in the young. But I've seen a lot of people even have it, a mini stroke, they'll call it transient attack. All because some people are deviated from lifestyle. But some person might not be having any of this nasty lifestyle. They may not be taking any of these illicit things. All of a sudden, they don't accept it to parent. That's why it's advisable to come to the hospital regularly. The hospital is the best place to be once you notice any form of aberration. In fact, once you regularly from time to time, at least every year or twice a year, patients go to the hospital.
You know, once somebody has respiratory issues, it's difficult for some of them to go to the hospital, particularly in this era of COVID-19.
I agree with you.
Because everybody is afraid of being stigmatized.
I agree with you. But I had a
because
cousin.
it's making a lot of persons go down.
I had a cousin long ago that has TB. And while he was in a long distance driver, he was sleeping with a prostitute and he died. So I was just going to other respiratory problems like TB, because there will be respiratory failure. And once you have a heart failure due to respiratory problem, that's called pulmonary. And the man dies. So if you go to regular checkup for the cough you're talking about, it could be TB. It could be chronic bronchitis. It could be people cough for no origin. It could be asthma. It could be bronchitis. Anything can be responsible for that risk. It could be allergic cough even. So the issue of corona, before the issue of corona came, a lot of people don't have the interest of going to the hospital. They just go to look nearby chemists. They are taking medication for cough. At times you cough so much that you become exhausted. And you know that some of these things that can lead to sudden death has to do with exhaustion.
Yes.
So that's why you see some people can pack with serotonin surgery classification. So it's not always the best to do, and once you take some medication and you're not getting the result,
Yes.
and after within a period of 1 week, you should turn yourself to clinicians to attend to you. Doesn't take much because it is easier to know the illness with quicker intervention than to allow the illness to lead to complication. More or less can lead to a sudden death. So that's what we are saying in this program.
All right, the number is 052-290-573 because I know by now you would want to call Dr. Barry Ojo to ask some questions, okay? Ask questions so that you know what to do. You know where to go to. You don't run to your neighbor to ask for the drug he or she used when he had a similar problem because we're always in this, oh, when you had headache the other time, exactly what drug did you use? You know, we do that a lot. That's not what we're preaching on this program, okay? 052-290-573 is the number to call. Do call us and then let's see what we can do for you this afternoon. All right, doctor, can you tell us ways to prevent sudden death in youths?
The commonest...
use normal, everyday language, please.
The commonest
so
way
that we know.
to prevent...
In youths first.
Yes,
because
in youth
they are the ones that are dying
is to
now.
create more awareness campaign, like we're doing in Healthy Living now, to let the youths out there understand that they need this healthy living. So they should not deviate from their lifestyle and their illicit, that they should not deviate from their normal activities. Because if you don't deviate from some things, you might not run into problem, even up to the kind of diet you take. So even among females, you can see some females, they will just eat, finally become obese. And from obesity, they cannot have any of this underlying problem.
Yes.
So it becomes a problem. So we are campaigning to the youth to say, please, be conscious of your health because you are the leaders of tomorrow. So that campaign, that awareness campaign is key. But of course, what stops the youths from turning to the hospital to do their regular check is very key. Of course, do your regular exercises.
You don't have to wait until you're sick
avoid smoking,
before you do that.
Do your compatible exercises.
Okay, let's take this call. You will continue. Hello, caller. Good afternoon.
Good afternoon.
Good afternoon. Please tell us your name and ask your question.
Yes, this is Barrister Felix. I'm speaking from First Secular sitting here.
Okay, thank you for joining us.
I've been saying what the doctor is saying.
Okay.
I want to appreciate you being the answer person and the doctor himself.
Okay, thank you.
Doctor, I'm of the opinion that this program is very, very important. I think there should be a repeat broadcast of it maybe on Saturday or on Sunday so that market women who are in the market now, traders who are not at home now or in their offices, so that they can listen to a program of this nature during weekend.
Okay.
That is one. Two, I want to also advise the doctor to reduce his speed.
Okay.
Because it's dealing with an important topic.
Okay.
That is exactly what that is my contribution. To reduce the speed with which he explains.
Okay, thank you very much, Barrister Felix. Thank you, we appreciate. So I hope you got that. You have to be calming down. All right, doctor is going to calm down. He's naturally a very fast speaker. Okay, before that call, you were trying to tell us how the youth can avoid sudden death.
Because the campaign in general, then the government has a lot of role to play. Then with other health workers, we should do community campaigning because you have to do participation because you have to move from environment to environment.
Now let's look at the issue of sport drinks because in recent times you find a different type of sport drinks. You know, some in cans, some in bottles, you know, some in sachet and all of that. And you see people going to the market to buy, to stock up their shop because come Friday, youths will come and buy.
Yeah.
You know, and sometimes when you see them, I usually have this feeling that this young man is drinking himself to death. You know, they just buy this sports drink. I don't know if there can be a law regulating this sports drinks. We don't even know where they come from.
Well, that's political.
And they come in different names.
Yes, that's political. So government has to be willing to think along this. But we need to still remind them because the energy drink contains a lot of lysine. The energy drink contains a lot of sugary contents. So there are so many substances in the energy drink or the sports drink that could over to be dangerous to one's health. Because some of these young individuals might be having some genetic predisposition. Because if the one parent is diabetic and you are not changing your lifestyle by way of taking some of these illicit drinks, you are increasing the risk of you developing such an illness. So we're advising the youths and general public. If adults get involved in this that you're talking about,
They do.
we should stay away from things like that because they run. In as much as we're not going to kill the business of those that are selling things like that, but take things minimally, not to begin to take it like an habit. The same thing they do with drugs. A lot of people want to take some drugs to do all their performance and all that.
Yes.
It becomes drug abuse. Of course, general word to be substance abuse. So
Okay, let's do this call. Hello, caller. Good afternoon. Hello, good afternoon. I can hear you. Hello? Yes, good afternoon. Good afternoon. If you reduce the audio level on your television set, we'll be able to talk. Hello? Hello, good afternoon. Okay, apart from drinks, are there some kind of food that can, cause sudden
Yes, of
death?
course, because if you look at the high fatty diets, where the that contain a lot of cholesterol, of course, it's going to increase the weight of the patient. It's going to cause a lot of fatty deposits. So some of those diets can be very costly. Of course, refined drinks, even not even the energy-giving drinks. These are diets that can cause problem for the individual. So we are telling the public that let's go after
Refined
diets.
drinks.
Yes, let's go after, of course, meat, red meat, for instance.
Okay, we'll continue. Hello, good afternoon. Thank you. Who are we speaking with, please? Hello?
Hello, I am Meng. I'm calling from Benin.
Okay, happy to hear from you.
Yeah, and also with you. I want to say kudos to Dr. Ujo.
Thank you.
Dr. Ujo, the topic you're speaking concerning fatigue, very small time, the person will just be feeling dizzy and all. So, I think I'm passing through that symptom. And there was a day I called you because I have your own personal number. You did not pick my call. You busy my call and never picked my call. So I want to see you one-on-one, Doctor.
Okay.
So you'll be treating me. You'll be treating.
Okay, madam.
Hello?
Okay, thank you. Okay, Dr. Ojo, your patient is commending you there. All right, we're talking about ways to avoid sudden deaths. If you know you have high cholesterol, you're obese, you have a funny lifestyle, so to speak, you've got to stop. But this lifestyle is seen as enjoyment.
Yes.
Somebody goes to a restaurant and you're taking like 40, 30, 20 pieces of meat and
yes,
they're
because
gone.
people see it as a way of
It's
life. We're
enjoyment.
talking about, apart from the drinks, we're talking about red
Food,
meats.
red meat.
Things like chicken eating the skin. Some of these things have a lot of high cholesterol. Of course, most of the drinks contain caffeine and all that. They are not friendly to the heart and the lungs. So that's why we're saying, even the brain. So that's why we're saying that we stay away from it. We avoid those
But
things.
unfortunately, the food that we help is not exciting.
Of course, that's
The
the
foods
truth.
are not exciting.
But that's the truth.
When you see the food on the table, you're not moved to want to eat.
But I agree with you. But the truth matter, they know you have to do with orientation. And some persons have some very good influence and all that. Honestly, we're talking about the child in the youth. My friends are doing it, I will do it and all that. We'll talk about India and coronavirus. You come and say, the lifestyle that has caused all the problem. So what we are saying is that let's not follow the crowd. Let's follow reality.
Yes.
So once we have any problem, we should be able to turn to the hospital. Because whether you like it or not, one way or the other, we might have some
So
medical challenges.
what kind of problems can red meat cause in a human?
Of course, it can cause even so. I mean, it can cause
And from what age should one be very cautious of
even
eating
as
red
young as in
meat?
the 20s, because it's one of the things that can predispose an individual to obesity. And it is one of those things that can cause even the problem of arrhythmias that you were talking about. The studies are there. So that's why we say we can avoid these things to be able to stay off and have a more healthy living. Because at the end of the day, we are talking about all these things. A lot of use involving smoking. And you know that in almost every illness, smoking is a risk factor, one of the commonest risk factors for all the pathology. Take up to Indian hemp, take up to cocaine, and all these are problems that can predispose the individual to any of these hearts or lungs or brain pathology that can lead to sudden death. So we must tell the youth, stay away from smoking, because federal government have only said smoking is dangerous to our health. So we must do everything under the sun to make sure that we should live a healthier living, improve our lifestyle, modify it. Then, of course, at the end of the day, we'll get it right.
That's for the youth. Now let's look at the adults, the big men and the big women, so to speak, the ones who are 40 and above.
Yes.
You know, sometimes some of them do die too.
Yes,
So
but
somebody will sleep and not wake up.
But you know what is worse with adult population? Most time when people get to between 40 and 50, they tend to have one medical condition or the other. Especially the non-communicable diseases like diabetes, hypertension, of course, problem with heart and lungs and all that. So when you now have some underlying pathology, and you are now coming to run a lifestyle, even some kind of diet that will worsen your problem. So it's actually a very challenging situation with the elderly and the middle-aged people. So that's why I use the body to say, do things according to your health background. Because if you think that, oh, I don't have BP, I don't have sugar, something must kill a man, that's not true. Because you have a family that you are raising, you have dependents. So you must, of course, some persons have underlying pathology. And there's no way you have good drug control if you don't have this improved lifestyle. You see some people going to party, a man of about 65 years, you are smoking, you are taking D5, you are jolling. And whereas you have an uncontrolled hypertension, which can worsen, can lead to a hypertensive heart disease that can emanate to acute myocardial infarction, which is heart attack. So people, they are on the drug, they don't take their medication. Of course, they will not have uncontrolled blood pressure. It can lead to stroke. That's brain failure. So it can be hemorrhagic, it can be ischemic, it can be thrombotic. That's why I hear some women, they just wake up in the morning. I like what our first caller said. I will this program, the market maker here. So many people are falling in the market and they die. Because they barely go for checkups. Because they don't have the time. Especially for low strata women in low strata, which most of them would want to be breadwinners.
Well, most people say going for a checkup as an elite thing. It's not for the common man.
Yes, because if you now have a pathology that is not being discovered, that go unannounced, the consequences are normally grave. So that's why you see when some persons fall, even though you have an AED, you might not be able to rescue the person. Let alone those things are not available. This artificial automated machine. There are many hospitals have it across the country to be able to give a shock reading to see if the heart can come back. How many governments to have it? So that's why we're saying that we should see the need, we should improve on our lifestyle, then our habits, our attitude towards a healthy living, then seeing the need to come to the hospital or the clinic so that you do general checkup. You can do routine checkups, you can do periodic medical examination, you can do detailed general tests for yourself. Yes, it pays you more than to say, oh, I'm okay, I'm fine, I don't have any problem.
You don't leave anything to
Even
chance.
the men that has problem, for instance, I know so many men, you have erectile dysfunction, you're not coming out. What if you are diabetic? What if other than that in that is responsible for it? What if I'm using the medication that is responsible for the erectile dysfunction? And you are not ready to come. So if there are so many of these drugs that can cause it. So why not come and even resolve your psychosocial problems? But they will just say nothing they happen, anything must kill a man. That's why I see more death in men in Africa than women. Because the women tend to have better health-seeking behavior. Just like we do, even the better religious behavior. That's why if you go to the church, you see more of men, then it's something else. So the women have better health-seeking behavior. Of course, parenting is the old age. So they will tend to come to the hospital. That's why I like what Akela said. We just say where the women council get these messages. So that because women are always on the run to make money and all that. So if you look at the story of the coronavirus, you can see the situation on the whole world now. 159 million people across the globe. It's not a joke. And America has the highest as 3 million. And as it does not, India has surpassed so many countries, now 22 million people. And that's crazy. They now have over 240,000 deaths. Brazil has over 21 million with over 595,000, over 400,000 deaths. And as medical experts have said in India, that by August they might go into 1 million deaths. That's catastrophic. A country that supplies over 4,000 vaccine coronavirus. It was attitude. In the midst of coronavirus, they were doing elections. In the midst of they were doing their Hindus religious activity. And coronavirus is all about separation. It's all about lockdown. It's all about distancing. It's all about hand washing. It's all about being careful with the net. Now they got another strain. So when they now had a different strain, the whole thing became disastrous. Look at the UK, for instance. They just had 127,000 deaths. There's still around 4 million people that suffer from coronavirus. Look at South Africa. What is going on in South Africa? They now have 1.5 million people who have the coronavirus. Of course, you know their lifestyle. They have the highest HIV in the world. 12 million people don't have another viral illness. And we're talking about healthy liver. Of course, they talked about legalizing abortion from Adam. The other time it was gay marriage. Now they are talking about polyandry for a woman to have more than one husband. It's a crazy society. Now with that, you have 1.5 million. And they've had over 59,000 deaths. Look at the case of Ghana. Ghana have 192,000 cases, but just 273 deaths. Look at Nigeria, for instance. We're doing well. 2,065 deaths. As of yesterday, to 165,419. That's good enough. That's the only one case of Edo State reported. That was somewhere in Edo Central. So Nigeria is doing when it comes to those things, like, because we already have a hunger virus. So we're already in depravity. So we don't want things that will exacerbate our situation. Because everybody ran into the house that night. But India was saying, but nothing they happen. Now they've been devastated for 1.2 billion people, and most of them have one child. So China knew from Adam. China has only one child. They have 1.3 billion. The world is about 7 billion people, and those two countries are about 2.5. So now look at what's happening to India. Community spread. They don't have oxygen. They haven't lagged the vaccine that they were giving to other countries.
I feel for
so that's why we're saying that. Look at countries like Burundi. They have on the least coronavirus. As if they are well. It's attitude. So we are saying that when it comes to sudden death, it could be avoided. It's just your attitude. And you have to be prayerful. Just prayerfully abide to what are the rules of the game. You have the problem, you go to the hospital. You pray about your illness.
Yes.
So at the end of the day, you don't have problem with it. So what I'm about to say is that we are appealing to the public that once you have a health challenge, see the need to go to the hospital. You get to, and that's why you get to have a family doctor.
But the problem is the hospitals are not cheap.
And that's why you get
either.
to see the way there's fighting so many homes. I'm a family doctor. The man is not well. You have a recurrent headache. You have a recurrent palpitation. Your heart is beating. You are aware of it. You have a recurrent chest pain that you cannot explain. The woman will say, "Come and go to hospital." I'm going to go to hospital. The man will be fighting. The man will be appealing.
The man will be fighting.
Tomorrow, if anything happens, they say, "Namikosa." The very educated class of people, I'm telling you.
But why is it like
so
that?
someone will now come to you as family friend or as family doctor to say, please, call my husband, this is my dilemma. The woman didn't say you should give her money. The woman said you must pay the school fees of the children. Yet, it's talking about your own self. You see the man still gorgeous, still gallivanting that I will not go. But you find yourself in a party. You find yourself in your friend's merrymaking. Whereas you can run into sudden death. That's the problem.
So lifestyle ought to be changed.
It should be key. And the issue of this hospital attendant should be primary. Because that is the only way you can have primary prevention. I present myself, I don't have any problem. Once in a while, they get headache, they check me. They will not do urinalysis, will do this, will do that. We can just pick up protein in the urine. You look at the sugar again, before maybe the BP is increased. We can pick nitrites, which is infection. That can lead to erectile dysfunction. We can just look, they take BP drug, okay, this drug, this one they keep prick now. You understand? So from there, you can even get a better solution.
Language.
No, what I'm trying to say is that a medication you'll be taking that another doctor has given to you, it clears the erection from Adam, from studies and from what you know. Every drug is a poison. What matters is the dosing. But as on drug, you must not give to a particular patient. That's what I'm saying. Now, the woman says she comes to a headache. The BP that you have here is not controlled. You're on abdomen. To write abdomen for a sexually active man is a sin, for instance. So that's what we're saying. Learn the habit of doing this thing. That's what you see in Japan. Let's start at 80. It's their good health-seeking behavior. It's not magic. Japan is not a pure Christian country. But we know that by 80, that's when life starts. So we should appeal to the public. They say they need to turn to the hospital. So at the end of the day, you can have a more graceful aging if you are the older group. Of course, a more healthy living if you are the younger group.
So the bottom line is, make sure you visit the hospital. You don't have to wait until you're sick before you do a routine check. It's not a big man's thing, it's everybody's thing. But the story is different for those who are, maybe middle class or low class because of the financial implications.
But government hospitals are cheap. You are not government hospitals are accessible. Up to now, so government hospitals take up to 500 naira. Even IUTH, you go in the hospital, our card is 500 naira. So what are we talking about? So it is the health-seeking behavior. It's not the cost. The same man that you're talking about that is not going to come to us, government hospital or a good private hospital. We'll go to the beer parlor and declare more than 8,000 for such elitist activities. So why do you think in America and the UK, people are placed on soluble aspirin or clopidogrel so that it will prevent heart from failing? It's a cardiac protector. It don't be said they don't want that. It's a habit. So why are we not having this pattern in this country? You know when to start having heart failure or arrhythmia for you now start or hypertension for now start taking those drugs. It's a routine in Europe and America. So that's why they're having longevity. And not just longevity, graceful aging. That's why we're appealing to them that look, most of this sudden death is not African science. And they quarrel for office. No. Most times they are supposed to be preventable death on this one. Whether you like it or not. I'm a believing, I know what I'm saying. So you must know that before you take it to metaphysics, bring it to the hospital first. Because there could just be immediate problems
before you do metaphysics and church.
So you come to the hospital while you are doing your prayers. Of course, there's no room to metaphysics because science is science. Medicals is medicals. That's how Nigeria got to try the coronavirus now. But the first time, because the thing came and hit politicians, it became a problem. So this is real. The Cardinal said the governor was even active in coronavirus pursuit. As I thought recently, the Cardinal, he even paid the money because it affected him. So he knew the implication. So now you can see us in the you can see the way we are last corona. Of course, I went to Lagos recently. Face mask is history. Nobody bothers about anybody. But let's just continue to shine our eyes. Because people are still coming from the other part of the world.
Yes. And
just recently, Spain, 2 days ago, has eased their lockdown. So we must be very circumspect. Distancing, social distancing, of course, continue hand washing, of course, community participation. Very importantly, the key to have face masking. For sudden deaths, it can happen to anybody. It has killed so many presidents of the countries. So we must be careful. So many presidents have died in the last 8 years.
Okay, quickly before we go, can you just outline what we should do now?
One, we should improve
gently.
One, we will improve on our health-seeking behavior.
Okay.
For children, parents must have high index of suspicion. Once children are having any form of complaint, take your child to the doctor.
hospital.
You
No,
must get
it's
the
not a
clinical
case
evaluation.
for PCN.
Yes, and this is not the time for PCN to nag the child. You must find out what could be wrong with the child. Even if you are going to be a medical personnel, let somebody else evaluate your child. So that you do objective. Of course, you are most likely not to be a pediatrician. So why will you be evaluating the child? You are not a family physician, you are not a pediatrician. So you let the child be evaluated by somebody else. Then of course, in young adults and adolescents, they should stay away from this illicit abuses we are talking about. All these too many energy drinks, too many D5, so many illicit substances that can take them to the early grave, if not entirely dead. So we're appealing to them to stay off those things. Anytime you have any complaint, if you don't want to come with your parents, if you are 22, you can come to the hospital. So you can meet your daughter, you can call your parents. Most of the problem we have with the youths and the young adults is that they have a problem, they'll be afraid. They get into my hospital recently, was bleeding. You are 19, you are afraid to tell your mother, who will pay the bills? Tell her, it's not a problem, it's one of those things. So you can get intervention. Because if the person is bleeding and you are pregnant, maybe it's ectopy or serious incomplete abortion, patient can die from there. So let's begin to carry our parents along as young people. Then for adults, let's live by example.
Or maybe the parents should carry their children along, because these parents are
yes,
just
that's what I'm saying.
have time for their children.
That's what I'm saying now. For adults, let's live by example. We should be having high index of suspicion of our children. Let's just prove to our children that they are the leaders of tomorrow and we can be better. Good hospital attendance, improve lifestyle medication, of course, avoidance of these risk factors that we talked about a lot in this program, and so on and on and on. So at the end of the day, society will be a better place to live in. Most deaths, and this one I must tell you, in this part of the world, are preventable deaths.
Thank you very much, Doctor. And I know that a lot of persons have been trying to call us. You can call this number immediately after this program so that we attend to you, because our time is up. So do us a call on 080-266 87187, 080-266 87187. That's the number to do us a call with, and you will get an answer, because we're still talking about stigmatization and all of that. A lot of persons don't want to call and they don't want people to hear their voices before somebody will start talking about them. That so person called to ask the question. Don't worry, just make yourself comfortable. Leave the talk for the person, okay? In as much as you have good health, then you are well and okay. You're just going to be happy. Thank you, Dr. Barry. We'll see you again on Monday. Bye-bye.